You know, when you stop and think about heroes, the ones who really show up for us,
Yeah.
they're often not the ones you see on, like, movie screens.
No, definitely not. They're the people right beside you, aren't they? Especially when things are tough.
Exactly. When you're feeling vulnerable, they provide that comfort, the expertise, and just, well, human care.
Absolutely. The actual hands and, the heart of healing
Yeah.
day after day.
And that's precisely who we wanted to explore in this deep dive. We looked at this really significant moment quite recently in India.
A moment of national recognition for these kinds of essential heroes.
Yeah. It happened on May 30th, 2025, and the setting was, well, pretty grand.
Oh, definitely. The historic Rashtrapati Bhavan in New Delhi, the heart of the capital. There was this real sense of appreciation in the air.
President Droupadi Murmu was there, and she wasn't honoring, say, politicians or celebrities.
No, she was honoring 15 individuals,
Mhm.
people who really represent the dedication and the excellence at the core of India's healthcare.
So our mission for this deep dive was to really get under the skin of this event.
Right. We wanted to understand, okay, who are these people? What makes their service so exceptional that they get this national spotlight?
And maybe what their stories tell us about just the sheer grit, the
Yeah.
compassion, and that relentless commitment that honestly keeps healthcare going across such a vast country.
So let's maybe unpack the award itself first. The National Florence Nightingale Award.
Good idea. Because this award, it carries some serious history, doesn't it?
It really does. It was set up over 50 years ago now,
Mhm.
back in 1973,
Wow, okay.
by the Ministry of Health and Family Welfare.
Right.
And the name itself, Florence Nightingale. Well, that tells you a lot.
Right. Instantly recognizable. Synonymous with modern nursing, really.
Exactly. The pioneer, the lady with the lamp. Her work was revolutionary because it wasn't just about basic care. She brought in science, empathy, discipline.
She fundamentally changed nursing into a respected profession.
Precisely. And this Indian award, established decades ago,
Mm.
it feels like a direct continuation of that spirit, honoring people who embody those same principles today.
Whether they're in a big city hospital or, a tiny village clinic somewhere remote.
And what they receive, it's a certificate of merit, a medal, and also a cash prize of 1 lakh rupees.
Okay.
But, while the money is a gesture, the real weight is in that medal and the certificate. It's this profound national thank you.
It's like the nation saying, we see you. We see the years, often decades of selfless work, and we value it deeply.
Yeah, exactly that. And looking at who received it in 2025, the roles themselves are quite telling.
They tell you where the real front line of healthcare is, right?
For sure. The recognition this year went across 3 key categories. Auxiliary nurse midwives,
A&Ms, you often hear them called.
right? Then lady health visitors, or LHVs,
Yeah.
and staff nurses.
These might sound like technical terms, but on the ground, their impact is just huge. A&Ms, you mentioned, they're like the superheroes of rural healthcare in India, aren't they?
They really are.
Yeah.
Often the first, sometimes the only, healthcare professional people can reach in remote areas, doing everything from helping deliver babies to giving vital immunizations.
Wow. And the LHVs, lady health visitors.
They're that crucial link within the community itself, working directly with families, focusing on maternal and child health, making sure health education actually gets to people's homes, bridging gaps.
Okay. And the staff nurses, they're kind of the essential all-rounders in hospitals.
Exactly, holding the fort. General wards, emergency rooms, specialized units, they ensure patient care runs smoothly, 247.
So recognizing these specific roles, it really highlights the different layers of how healthcare actually gets delivered in India.
It acknowledges the vital work at every single level, from the village right up to the advanced hospital.
And this is what really brought it home for us when we looked at the material, the individual stories.
Oh, absolutely.
These 15 people coming from such different parts of the country, each dealing with their own unique set of challenges. It's not just a list. It's like this living map of dedication across India's incredible diversity.
Just think about the environments they work in. We saw examples of people in places so remote, so geographically tough. It kind of stretches the imagination.
Like who?
Well, there's Ribarani Sarkar. She works in the Andaman and Nicobar Islands. That's distant. And it means literally navigating difficult terrain just to reach patients.
Incredible.
Or Razia Begum, PB. She's in the Lakshadweep Islands, tiny islands. If someone needs serious medical help, getting to a hospital might mean a boat trip.
Wow. Just accessing care becomes a major hurdle.
Exactly. And then you have Saroj Fakirbai Patel. She doesn't just work near communities. She actually treks through forests to reach tribal populations in Dadra and Nagar Valley in Daman and Diu.
Trekking through forests, that level of commitment is just extraordinary, isn't it?
It really is.
Yeah.
Then you shift focus maybe to the rural heartlands,
Hmm.
areas where resources are often, really stretched thin, right? You've got people like Velavedi Supavati in Andhra Pradesh, saving lives, especially mothers and babies, in conditions where basic supplies might feel like a luxury.
Doing critical work with so little.
Or Sujata Ashok Bagul in Maharashtra, really focusing on empowering women's health in rural clinics. And Bina Pani Deka in Assam, running community health programs that are changing lives, even though getting access to her area is difficult.
And the kind of resilience you'd need in rugged places, like Kijum Sora Karga in Arunachal Pradesh.
Yeah, dealing with emergencies, chaotic situations, maybe unreliable electricity,
Yeah.
providing that stability.
It's a world away from, say, a big city hospital, but the challenges there are intense, too, just different.
Absolutely. Take Dimple Aurora in Delhi. She's
Mhm.
providing that calm presence, that critical care expertise, but in the super fast-paced, high-pressure environment of a major urban hospital.
And then there's the sheer depth of experience, like Major General Sheena PD.
Monumental career, 39 years.
39 years dedicated to military nursing, also based in Delhi. Her impact isn't just years, it's countless lives, countless careers she must have shaped.
And across all these settings, urban, rural, remote, military, you see this incredible range of contributions being highlighted.
Yeah, delivering babies in tough circumstances, making sure kids get vaccinated, tireless work on maternal and child health.
Battling specific local health issues like anemia, promoting family planning, health education.
Then there's the high-stakes stuff, emergency care, trauma care, like Lemapakpam Ranjita Devi in Manipur, working where split-second decisions and real courage are needed daily.
Infection control is so critical. Patient advocacy, like Vila Mangahi in Mizoram, being a voice for patients who might not have one.
And even improving the systems themselves, like Ellis Matamosi in Puducherry.
Right. Finding better ways to sterilize operating rooms. That directly improves patient safety. It's innovation on the ground.
And we can't forget the immense effort during the absolute peak of the COVID-19 pandemic. People like K. Alamalu Mangera Karasi in Tamil Nadu, truly on the front lines.
What all these stories make crystal clear is that this is so much more than just a job description.
It really is. It's service. It demands not just skill, but that incredible grit, that deep compassion, and this constant need to adapt literally minute by minute to whatever the local reality throws at you.
Often under incredibly demanding, unpredictable conditions.
Which just reinforces that point we touched on earlier. Nurses really are the irreplaceable backbone of the whole healthcare system.
Think about it in practice. The doctor diagnoses, sets the treatment plan, sure, but who's there, hour after hour, watching the patient?
Noticing that tiny change in breathing or that slight shift in color.
It's the nurse. They're the ones providing comfort when you're scared, explaining things simply, and they have those almost magical skills.
Like finding that vein for an IV when nobody else can.
Exactly. And we have to be real about what the job entails, based on what we saw. It's physically hard work, long hours on your feet.
It's emotionally draining too, isn't it? Dealing with illness, pain, loss, constantly.
Day in, day out. And yes, it involves tasks that, frankly, require strength of stomach and spirit most people just don't have.
And in the Indian context specifically, these challenges often get magnified, right? Limited resources, sometimes outdated equipment.
Chronic understaffing in many places. And the tough reality of patients who sometimes just can't afford the care they desperately need.
And sadly, there can still be this lingering societal view sometimes. This stigma, almost.
Yeah, that it's just a job, maybe just for women.
Which completely misses the immense skill, the critical thinking, the knowledge, the sheer dedication involved.
Which makes that ceremony at Rashtrapati Bhavan, at the highest level of the nation, even more significant.
It was this powerful moment of national acknowledgement, wasn't it?
Definitely. And you had not just the president, but key government figures there too. Union Health Minister J.P. Nadda, the Ministers of State for Health.
Pratap Jathov and Anupriya Patel, their presence underlined the government's recognition.
And Minister Nadda's words were very clear. He called nurses the backbone of the healthcare sector, directly praising their selfless service. That's a crucial message.
Affirming their vital role. And we also saw mention of some systemic efforts to, try and strengthen nursing in India.
Yes, like the recent National Nursing and Midwifery Commission Act. That's aimed at modernizing how nurses are educated and how the profession is regulated.
And that big move establishing 157 new nursing colleges alongside medical colleges.
Yeah, that's a major push to boost the number of trained nurses and hopefully improve the quality of training available across the country. Necessary steps, really.
Absolutely necessary. But even as we see these important moments of recognition, these systemic steps, we have to come back to those daily challenges.
The reality on the ground, the resource gaps, the emotional toll, the physical strain, that lingering perception issue.
It really makes you wonder, doesn't it? With all those difficulties, the hours, the stress, the sometimes inadequate support, what keeps them going?
What fuels that dedication year after year, patient after patient?
And what seems to come through again and again in stories like these, it's this profound passion, a passion for care itself.
It's those moments, right?
Yeah.
Often small, often quiet, but deeply human. Those are the things that make it all worthwhile.
The first cry of a baby they help deliver safely.
Yeah. Or that tired, grateful smile from a patient they've pulled back from the brink.
Just being there, providing comfort to someone in pain or fear. Those connections, that direct human impact.
That seems to be the enduring fuel, even on the absolute hardest days.
So as we wrap up this deep dive into the 2025 National Florence Nightingale Awardees, we've really journeyed through some incredible stories, haven't we? And seen the significance behind this recognition.
Yeah, these 15 individuals, Reba, Velavetti, Saroj, Razia, Sujata, Bina, Kijum, Dimple, Sheena, Banu, Ranjita, Lalmangahi, Manamosi, Alamilu, and Doli. They're not just award winners.
No, they're powerful representatives of the dedication and, frankly, the sacrifice of nurses right across India.
They're not just healthcare workers. They're community builders. They're lifesavers. They're sources of comfort and strength when people are at their most vulnerable.
Absolutely. And it kind of leaves us with this final thought, something for you, the listener, to maybe chew on.
What does it really take, day in, day out, to be that steady hand, that skilled caregiver, that compassionate presence on the healthcare front lines?
And maybe more importantly, beyond these vital moments of national recognition, what more can we as a society, as a system, actually do to truly honor and support these essential heroes, not just with an award, but in the everyday reality of their demanding, crucial work?